I think everyone's heard me repeat epi everywhere, every day, enough in this program that you're probably wondering, oh, where's she going with this? We're very excited. You know, the mantra is epi everywhere, every day, because that is what is going to save lives. So we're launching this back to school season 2012. An Epi Everywhere, Every Day campaign with posters, little bag tags in the shape of dog tags. They hang on your purse or your backpack, your gear bag, your athletic bag, and it basically says, my epinephrine is inside. And we have other education materials for the ACE teams to use, also some media outreach templates, and also some information about how to work with policymakers if your school is implementing a new law, or if your state is considering stock epinephrine laws for the upcoming school year. You know, states are increasingly considering these laws. Let's make sure that they're evidence-based. Let's make sure that they're funded so they're actionable. And you know, let's make sure they're done right. And our ACE teams can do that.
I'm Dr. Monica Kraft, and I'm a professor of medicine at Duke University and currently the president of the American Thoracic Society. This is a specialty society made up of about 16,000 physicians who are pulmonologists with an interest in obviously respiratory issues, critical care physicians, and sleep physicians. So I also direct the Duke Asthma, Allergy, and Airway Center and have been involved in both research and care of patients with asthma. And my group and I have over 140 publications along these lines. So it is with this professional and scientific background that I come to you today to present testimony on the behalf of the American Thoracic Society on this issue of restoring epinephrine inhalers back to the U.S. marketplace. It is my strongly held view and the view of the American Thoracic Society that returning these inhalers to the U.S. market, even for a limited time, is ill-advised. But I would say to you today that epinephrine is not one of those medications considered safe. So I'm coming to you from a safety perspective. So epinephrine is a non-selective bronchodilator. So yes, it dilates, it bronchodilates, that's good, but it also has other effects, primarily cardiac, that's very concerning to me and my colleagues. This can lead to excessive cardiac stimulation, heart rate, that can lead to heart attacks, especially in the older patients or those folks who have heart disease. And sometimes we don't always know who has heart disease. Now, for years, the medical community has recognized the dangerous side effects of epinephrine in the treatment of asthma and recommended against its use. The American Medical Association has urged warning labels. They've encouraged FDA to consider removing inhaled epinephrine. They've requested studies to really determine, does it contribute to increased asthma morbidity and mortality? Now, I would be interested in hearing more about these deaths that we just heard mentioned in the last testimony, because in speaking to my colleagues in emergency medicine, and my husband runs the emergency department at the University of North Carolina, Chapel Hill, and my colleagues at Duke, their perception is since Primatene Mist has been off the market, there have been fewer severe exacerbations. And so we hypothesize that, in fact, patients are now getting the care that they need. We have a mechanism to take care of those patients who are uninsured, those underrepresented minority patients. I live in Chapel Hill. I see patients from Durham. We have a very significant contingent of underserved patients that we take care of at our institution, and we can provide them with the right medication. So I don't necessarily think it's all about access. So furthermore, the guidelines that put forth the treatment of asthma do not mention epinephrine as a viable option for treatment, and I want to make sure that that's clear. The National Asthma Education and a Prevention Program, put together by our own National Institutes of Health here in Washington, the U.S., have emphasized that inhaled medications are critical for asthma therapy, but not epinephrine. So the American Thoracic Society strongly encourages any patient who is using over-the-counter medications like Primatene Mist to seek care from a provider, and there are ways that these patients can get help. And I'm a strong advocate, again, for allowing patients to learn how to take care of their own asthma and manage their disease, because it's really all about putting the power in the hands of the patient and teaching them what they need. So if one of the goals of today's hearing is to discuss the pros and cons of enacting legislation to permanently or temporarily restore inhaled epinephrine for the treatment of asthma to the U.S. market. If the intent is to restore a safe and effective medication, I think that is a laudable cause, but it's misinformed. Inhaled epinephrine is not safe for the treatment of asthma, and no current clinical practice guideline calls for the use of epinephrine.
As Congressman Weldon explained, I'm an allergy researcher, asthma researcher. I've conducted over 300 clinical trials with over 200 new state-of-the-art medicines for asthma, and I care for 10,000 asthma patients. And I trained with Monica. I will say that I'm a member of the American Thoracic Society, a fellow of the American College of Allergy and the American Academy of Allergy, and never once have those organizations pulled me or any of their general membership on the issue of Primatene. Now, my comments today briefly.
I'm sorry, sir, your microphone popped. Could you make that statement again? I missed it.
I thought the microphone was on. I wanted to just state that I am a member of the American Thoracic Society for the last 10 years, a fellow of the American College of Allergy and the American Academy of Allergy, and never once have those organizations pulled myself or any others of the general membership on the issue of Primatene and the safety of Primatene. So what I will tell you is these organizations are speaking on behalf of the administrative doctors working there, but not on behalf of the general membership. Now, what I want to say is that I think we live in a difficult era in science and culture. There are major scientific advances happening all the time. And I'll just say that that's how I spend 90% of my time, doing clinical research with some of the latest, most advanced medicines for asthma. Science tells us CFCs can be harmful to the ozone layer, and they do need to be removed gradually over time. And that's happened with hairsprays and air conditioners and refrigerators. And I'm happy to say that there are many new HFA medications that are available for asthma. So science is moving forward. We hope that there'll be an HFA Primatene, perhaps within a year. But I have to say that there are also many issues of practicalities that critically need to be considered when any new law is implemented. And science cannot just be implemented as a blanket process. It has to be implemented in a rational way. Asthma, as you've heard, is a disease that strikes in the middle of the night. And I don't know many private practice doctors who are going to be available 24/7 if you suddenly need a prescription medicine. Asthma occurs at your 4th of July picnic. It's going to occur when you visit your least favorite relatives who have 5 cats at home. Asthma may affect your college daughter when she moves into a basement apartment that has mold in it. They occur when you get out and run a 5K or a 10K running race, and it will hit you when you come to visit me in Oregon, where we have horse farms and hay farms. What I need to make clear is that despite all of the science, which I'm happy to discuss endlessly, Primatene Mist is a first aid situation kind of medicine. The reason it's over the counter is that there need to be immediate access, immediate use medicines available to children, poverty-stricken patients, elderly people who have acute airway dyspnea. It's similar to choking, where a Heimlich maneuver is needed. It's similar to a bee sting, where Benadryl can be picked up at any convenience store. We need regular access to emergency medicines. Now, the American Thoracic Society and others may say you can get albuterol HFA, but I challenge them. That is simply not true. There are many, many Americans who have no insurance, they have no doctor, they have no prescriptions. They cannot simply get albuterol HFA. The best analogy that comes to my mind is basically a life vest or a life raft on a ship. We've all seen the Titanic movie. We know what happens if there are not enough life vests or life rafts. Now we've seen the Costa Concordia ship. The question is, should all the life vests be locked up where only the ship's doctor or the ship's captain has a key? That simply does not make sense for a medicine that can be life-saving for poor people in inner cities. I'm going to end by reading a brief poem. This is a little over the top, but this is the poem engraved on the bottom of the Statue of Liberty. A little excerpt. It says, "Give me your tired, your poor, your huddled masses yearning to breathe free. Send these, the homeless, tempest-tossed to me. I lift my lamp beside the golden door." Now, what that means really is that we live in a country where there are many people who don't have opportunities to see fine and wonderful doctors. They need some temporary relief medicines. Scientifically, we're all in favor of HFA, over-the-counter medicines, but there are none. So I would ask the committee to consider extending the use of Primatene. It's the only available rescue medicine for up to 30 million Americans who don't have health care. Thank you.